Okay. I'll be very quick on this. I'm not going to go through all the slides, but they will be available afterwards. So I'm just going to hit on 1 or 2 points. Thank you for those staying in the room for this. So just around clinical documentation, you'll know that it's a challenge. It's internationally a challenge, and coders rely on documentation. They can't assume anything. So coders are relying on that documentation. But we are seeing advances and improvements in documentation, particularly where we have engagement with clinical programs, where data is being utilised and scrutinised, and they're using it for reports or reporting on. They come back to us with queries, and that is driving an improvement in quality data. Also with NOCA, on the use of HIPE data in their audits. So a lot of that is helping to drive improvements in documentation. For ICU, we have the NOCA ICU audit, and that's available locally for hospitals, for HIPE departments to be able to access and utilise for assisting with HIPE. And also in the HSE internal audit division, their healthcare audit unit are now including they're not auditing HIPE data, but they're also including now, like if there's a discharge summary, or is there mention of a particular condition on the discharge summary if they're doing the audit on that. So that's another very interesting development around advancing clinical documentation. EHRs, very briefly, we have seen some rollout of EHRs. There's various systems developing, and we also have been able to do one remote audit ourselves in one hospital that has EHRs, which worked very well. But we found that, and it's actually back to what Bernard Gloucester said this morning, that face-to-face piece was actually missed in the remote audit, that we missed that interaction with the coders during it. So it's an interesting piece. And just also, I wanted to mention that European Health Data Space project. I think that's very interesting for those of us involved in collecting health information. And it's worth having a look at that. And it's been mentioned at a few presentations today. The National Shared Care Record has also been mentioned, and they have formally sought engagement with HIPE, with the HPO and the HIPE governance group around using HIPE as the provider of procedural information for the National Shared Care Record. And I just think it's very interesting because that brings HIPE right to the front of healthcare records. We're not at the back, we're not, in the background as an output, but it puts us into the very front of healthcare records. So I think that will be an opportunity for improving documentation as well. And this is kind of my main piece, is that we've had initial contact with the Royal College of Surgeons and the School of Pharmacology, and we are looking at engaging with them around including a module for final year medical students on HIPE and clinical documentation. So currently final year medical students, they do one record keeping workshop in groups of approximately 20 students at a time. So it's in that workshop that we're hoping to be able to present about HIPE and clinical documentation. So we're delighted with that. It's early days, there's only initial discussions at the moment, and I just want to thank Dee Burke at NOCA, Dr. Myrna Spooner and Professor Judith Strawbridge for their support in this development. So hopefully we'll have good news there. So we are trying to raise awareness and bring things up as we can at national level, but I would call on hospitals again at local level to try and drive those kind of improvements as well. I've put in some suggestions there about different things that may assist with that clinical documentation improvement work. We are seeing advances and we will keep you posted, and that is it. Thank you, everyone. Thank you.